The following segment is sponsored by Optum Utah. October is Breast Cancer Awareness Month, and it affects so many people. And Karina from Optum Utah is here with some important reminders about prioritizing our health. Karina, thank you so much for being here.
Yeah, thank you for having me.
This is the month, and it affects a lot of people. My wife's mom passed away from breast cancer and complications from that when she was just young. A lot of people. What do women need to know specifically about breast cancer?
Yeah, just like you said, it's extremely relevant and pertinent to every single one of us. Unfortunately, breast cancer is the second most commonly diagnosed cancer among women. In general, catching cancer at earlier stages makes it easier to treat and provides a better prognosis and better outcomes. And so we're here to talk about the importance of the annual wellness examinations and being up to date on your preventative screening so that we can catch things as early as possible.
Absolutely, because there's a lot of risk factors. What are they?
Yes, tons of risk factors. So age is a big one. Breast cancer is most commonly diagnosed in women over the age of 50. Then you have family history. So do you have any family members who have prior history of breast cancer? More specifically, any history of the BRCA gene mutation? Any personal history of any other types of cancers increases your risk of breast cancer. And then lifestyle habits. So studies have shown that obesity, sedentary lifestyle, excessive smoking, excessive alcohol use, all of those can impact your risk.
All things to keep an eye on for sure. What about symptoms?
Yeah, so that's why these preventative screenings are so important, because breast cancer is often completely painless, completely asymptomatic. And so it's really hard to catch signs and symptoms on a physical exam. But what you're looking for in general is any new breast lumps or masses, any changes to the symmetry of the breast tissue, any nipple discharge, changes in the texture of the skin. In general, these signs and symptoms don't mean you have breast cancer, but those are all signs that you should take to your primary care provider to talk about.
So that's what we got to do. If we start to see some of these symptoms, what should we do? We go to our primary care?
Correct. Yeah, your primary care provider and your annual wellness examination can be that first step in talking about conversations of what screenings you qualify for.
There you go. And what health professionals recommend regarding screenings? What is that?
Yeah, and unfortunately there's still some differing in opinions of guidelines, but if you're looking at the United States Preventive Task Force Services, they recommend screening starting at the age of 40 every year, versus like the American Cancer Society can recommend starting at the age of 45 every 2 years. In general, as a primary care provider, I always advocate for my patients to get in for screening as early as age 40 and so on annually, regardless of risk factors.
It's a big problem, but we're getting some big answers too along the way. So what treatments are available?
So tons of treatments available, tons of ongoing research still available and still happening, but in general, the treatment depends on the type of breast cancer you're diagnosed with, as well as the staging. So when we talk about staging, we're talking about, is it still in situ, inside the duct, or has it metastasized at this point? Treatment options include options like chemotherapy, radiation, surgery, hormone therapy. All of that depends on your diagnosis, and is a conversation for you and your providers.
We hope that those options are getting better and better every single day. So where can we go for more information about all this?
Always talk to your primary care provider first. I think they're the first line of treatment because they know you best. American Cancer Society is a great resource, and then optum.com/Utah is a great resource as well.
All right, Karina, you have all the answers. Thank you for being here.
Thank you.
This
Thanks
October.
for having me.
I appreciate you bringing the awareness. Thanks so much.